All right, welcome everybody. Thanks for taking time tonight to join us. It is Lyme Disease Awareness Month, which is why we are doing this Zoom tonight. So if you're tuning in, I'm suspecting that you either know someone in your friends, family circle of people that you care about maybe has been touched by Lyme in some way. We're going to hear from someone tonight in fact, I have goosebumps even just thinking about her. Her story is incredibly impactful. I'll be honest, I didn't know much about Lyme until I met Liz, who you're going to hear from in a little bit. So I've learned a lot over the last 4 years. My name is Holly Tomet, and I'm coming at you from Michigan. We're finally getting some spring weather here, moving into the season for ticks, which is, again, another reason to hop on tonight and learn a little bit more. I know I'm still going to learn some of what she's going to share. I've seen the slides that she has for you, and they're very, very educational and informative. If you can, in the chat for us before we get rocking and rolling, a couple things. Tell us where you are watching from. We'd love to know where you're from. Maybe even who invited you to tune in. I'd love to know if you or someone you know has had, been affected by Lyme in some way. And then just a couple things I want you to be aware of. At 8:30, we're going to try to be as punctual as we can here, but we don't want to rush the information either because it's far too important. But at 8:30 tonight, if what you hear tonight prompts you to want to learn more, there's a couple things we want you to know. And I'm telling you now because I promise you I'll forget, because that's just what I do. Tonight at 8:30, there is another Zoom taking place, and we've already put the information in the chat for you. 2 doctors are going to be interviewed by a friend of ours who's been with our company for 14 years. And it's going to be a great Zoom. I'm looking forward to it myself. We might go a little bit over. I can't promise we'll be right off at 8:30, but we're going to do our best. And then the other thing I want to let you know is, again, if what you hear tonight prompts you to want more information, please know that we have an amazing website link that can be shared with you. Whoever invited you can get that to you. It's called livingactivated.info. Great educational source for you to go there and learn more. There's also an ABC primetime video that gives some history about some information we're going to share with you. Whoever invited you, ask them for that as well. And again, if what we're sharing doesn't prompt you to learn more, that's okay. But if you want to dig a little deeper, we have that information for you, and I do not want to neglect to share that with you. So, all right, you guys, we're going to jump into this because I want to introduce to you my friend Liz Goring. Liz lives here in Michigan with me, actually. We're almost neighbors. She's not too far from me. We met about 4 years ago. And Liz is a personal trainer. She's an educator. She's a mama. She's an intense athlete. Like I'm actually jealous because she's amazing. She's a wife, and she was touched by Lyme in a way that she's going to share with you that, again, I said it gives me goosebumps. So Liz, I'm going to turn it over to you. She's going to share some slides with you guys, some information. Then she's going to turn it back to me, and I'm going to go over a little bit of science with you at the end of some information that she's going to touch on. I'll go a little bit deeper. Okay, so Liz, it is all you.
All right. Thank you, Holly. I appreciate the introduction, and welcome everybody. Yes, May is Lyme Disease Awareness Month, and primarily because those nymph ticks are out. The baby ticks can be as small as a sesame seed. And Lyme disease has been found in all 50 states, Canada, and every continent except Antarctica. So it's very important to create awareness and advocate, primarily because of what I've gone through with my family and kind of the history that I've had with this ever rapidly growing disease. So this is my family. My husband, Carl, almost 20 years. My oldest daughter, Emma. I have a 12-year-old Allie and a 10-year-old Kate. And all of us, it's kind of a crazy story. I kind of don't know where to start because of all of it, but about 7 years ago, I was finally diagnosed with Lyme disease that went undiagnosed for about 18 years. So as crazy as our journey has been, I ended up transmitting Lyme to all 3 of my kids in utero. So I kind of want to go in reverse, just so you kind of get a picture of how I connected all the dots and how I believe this all started. And just a snippet, I'll give you the Reader's Digest version, because we could be here all night sharing the years and years and years of issues that I experienced that I know a lot of you have hopped on probably can resonate with. So I'm here today to tell you and kind of be a beacon of hope that healing is possible. I never imagined that at 43, I'd feel the best I've felt since I've been 17 years old. And this is why I get on and share with you. And this is my hope, is to be able to help and inspire others to kind of keep advocating and keep working towards becoming who you can be again, because our bodies have amazing capabilities to heal. So back in 1996, I went camping in Colorado, and through the mountains. We slept under the stars for a whole week. I got back and I got really sick and developed Bell's palsy. Well, at the time, doctors had no clue what was going on. They weren't sure. It was kind of a mystery. The paralysis did come back in my face. I never recognized any type of bullseye rash, which is like the telltale sign of Lyme disease. But from then on, my health started to decline. A year later, I'd struggled with shingles. Like, who gets shingles at 17? My immune system was clearly compromised. Going into my freshman year of college, I struggled with mono, so the Epstein-Barr virus got into my body. And then all the neuro issues started. So throughout college, and I met my husband when I was 19. So he saw my health decline throughout the years. And being an athlete and kind of a vibrant personality, I just kept moving on. We had seen doctors when I was in that state. I started having high anxiety, a lot of insomnia, other issues, very much neurally related. And again, they chalked it up to life, stress, change, going away to college, all these things. They masked it with pharmaceuticals, things, but I just truly knew at the core of what was going on with me that it wasn't getting to the root cause and something else was going on. So outside of college, fast forward a little bit, I started having a lot of chronic pain, a lot of migratory pain. I was in and out of specialists. You name the blood test, I probably got it. They thought I had MS, lupus, every autoimmune disease. Nothing came back positive. So again, it was in my head. It was this, it was that, you're fine. And I lived like that. I lived like that for a long time. And I kind of get emotional thinking about that, because so much of my life was lived in a fog and trying to figure out what was going on. So you name the therapy, you name it, you name the specialists, I probably was there. Fast forward a little bit later, I had issues with fertility. So I had a lot of different hormonal imbalances, numbing and tingling in my extremities. I was having brain tremors, they call them. I mean, the insomnia was a huge thing. I think I didn't sleep for like 3 to 4 years. It was very intense. And again, pharmaceuticals, sleeping pills, anxiety medications, painkillers, injections. The list goes on and on and on. So I'm not going to talk about all of that, but I know that a lot of you dealing with Lyme can resonate with what I went through, and kind of how I kept choosing to move on and moving forward and advocating for myself. And I will say that when the birth of all 3 of my kids, and we started having health issues with them, we were in and out of specialists with them, had no clue what was going on. My oldest had severe migraine. She missed 46 days in 2nd grade. My middle had a lot of different developmental issues that we were really concerned about. And being an educator and my background with literacy, I knew that it wasn't just a developmental delay. There was just something not right. You got that mama feel, and you advocate for your kids. We had our house tested for black mold, nothing. Just, they were always sick. When my littlest came around, which was kind of a miracle because I could not get pregnant, she had a lot of GI issues. She had SIBO. She had kind of that like Ethiopian pot belly, a lot of issues with parasites, craziness. So how did I finally get a diagnosis? Well, 52 doctors later, I started kind of dabbling with the other side of medicine, and a couple of homeopaths out in California uncovered a couple of different co-infections that I was dealing with. And I'm going to go into a little bit about what co-infections are and how they can coincide with Lyme disease. And a lot of times these ticks can carry co-infections, but they're the ones who said, we think you're a full-blown Lyme patient. So lo and behold, they referred me to a Lyme literate doctor out in Irvine, California. We used to live in California. And 2 blood tests later, the Western blot and the ELISA, I tested indifferent on the Western blot, and then on the ELISA, I tested positive. So they got all 3 of my kids in there after hearing the health history of all of them, and all 3 of them tested positive on both tests. Now that's not typical because we know that testing for Lyme can be very finicky, and I'm going to go into a little bit more details about that, but it kind of clinically diagnosed me, and we were able to kind of move forward with treatments. And there's a lot of treatments and a lot of ways that you do, and you're probably like, what, how did you get to where you are today? And it's like, there's a lot of different things that I did to help myself. And prior to learning about cellular activation, what we're going to talk about a little bit later, I was doing a lot of the things. I was doing chelation for heavy metals. I was doing herbal medicine. I did do a huge antibiotic bomb in the beginning, but we know that Lyme can take 3 different forms. And so the antibiotics, you're adding other different antibiotics and different things to break down biofilms and all that stuff that I'm not going to go into the details of all of it, but detoxing, cleaning up our toxic load, all the things that I knew I needed to do to heal. I listened, I learned, I got ourselves into a remission state, and the true healing has really been the past 4.5 years. And I'm gonna go more into kind of what that was, but I can say that today we are definitely different people, and through all of that is why I hop on here tonight to share. So I'm going to kind of move forward here and talk about what Lyme disease is. And we know that Lyme comes mainly from ticks. They carry the Lyme disease. It can also come from mosquitoes, spiders, and other biting insects. They can spread the disease, but primarily it's these ticks. And ticks are everywhere. And honestly, the CDC estimates that 476,000 people get Lyme disease each year in the United States. That's 1,304 cases per day. And you can kind of see here the states that are primarily higher from people being diagnosed with Lyme. It's more of the Eastern, we've got the Midwest, but it's everywhere. There's not one state that we can say there's not Lyme disease present. So this is kind of the forecasted prevalence of Lyme disease for this year. And you can kind of see over here the percentages and the different colors of the areas that are greater than others. So this is to create awareness, and so that you know that it is everywhere, that you can pick it up from different places, and not just how people always kind of used to say, oh, you don't live on the eastern side of the United States. So the deer tick, which is also called the Western black-legged tick, is primarily the tick that carries the most Lyme bacteria. And the life cycle of this Western black-legged tick generally lasts for 3 years. So during this time, it goes through 4 stages. It starts as an egg, then a larva, nymph, and adult. After the eggs hatch, the ticks must have blood meal at every life stage to survive. And infected ticks transmit disease to humans while feeding. So this is how people and animals contract Lyme. But with that said, there are other ticks out there, and these are just kind of an example of some of the other ticks, and they can carry Lyme and they can carry other co-infections. So it isn't just the deer tick. So just being aware, the longer a tick is attached, the greater the chance of transmitting disease. However, there is no studies showing the minimum attachment time for transmission of Lyme to humans, especially for the nymphal ticks. And those are the ones you can see on the finger there. It's like as little as a poppy seed. In fact, yesterday we just pulled a tick off of our dog. And so they're out, and it was little. So just being aware that they come in all different sizes. So what are some ways that you can protect yourselves? And by no means are we not encouraging you to go live life, because I still choose to live life. I'm not going to lie when I say I have a little anxiety in the woods because of everything I've been through, but I'm aware, and I just know that I need to move forward and keep living. And these are some things that you can do. So just walking in the middle of the trails, not going off the beaten path, wearing maybe a hat, tuck in your hair if possible. They really like to go into the warmer areas behind your ears, behind your knees, and your armpit areas. Wearing long sleeve shirts that have fitted wrists so they can't go up your sleeves. Shoes, wearing long pants, maybe with some elastic around the bottoms, using some type of insect repellent or a lot of different oils that can deter the ticks. I know that my husband was just out the other day, and we have like a lawn, and I can get the name of it for you, but it's more of a natural type spray that we sprayed our yard with because we do live by the woods. Wearing lighter color clothes if you know you're going to be in the woods, because you'll be able to see them better if they do attach themselves to your clothing. You can do tick checks immediately and 3 days after being outdoors. If you find a tick, remove it carefully and save it. You can save it in a plastic bag, and there are places, if you have been bit, that you can actually send them away to be checked for different co-infections in the Lyme. And I'm going to go into that a little bit too. So, and of course, your furry friends, if you want to talk to your vet, there are different precautions and things that they can do for animals with Lyme, or not with Lyme, to prevent them from getting Lyme. So obviously the higher risk activities outside is just playing in the leaves, gathering firewood, leaning against tree trunks. Also golfers, they're at high risk of Lyme disease. Fairways and roughs offer the ideal environment for ticks. And then our furry friends, including horses. We know that tick checks aren't only for humans. Check your furry family members when they come indoors, and paying close attention to their paws behind their ears. I know just when I was petting my dog yesterday, it was right on her back. So just being aware, because they can bring them in the house. So there's different insect repellents that you can use, and there's different oils. I know that lemon eucalyptus oil is a big one. We do have a blend that I actually got at Costco. It's a more of a natural blend. And then you obviously have the ones with DEET and other things. So how to remove a tick, you want to do it very carefully. If it is attached or embedded, you want to make sure to get the whole tick out using tweezers. You want to grasp the tick as close to the skin as surface as possible and pull up steady with even pressure. You don't want to twist or jerk so that the mouth parts break and they can remain in your skin. After removing the tick, you want to clean the bite area thoroughly with rubbing alcohol, soap, or water. Never crush a tick with your fingers. And you can save the tick for testing in a small bottle, plastic bag with a damp piece of tissue. We actually just a couple weeks ago, my middle child, it's like any person with Lyme disease worst nightmare when you get a phone call from the office telling you that there's been a tick found in your daughter's hair. So we do not think it had bit her. It was not engorged. So we did keep it and we saved it. And we sent it away just to be safe, but I think we're all in the clear. So I'm not worried about that. But a couple of years ago, we had another scare with one of my other daughters, and the same thing. It did bite her. We did take it out. We did send it away for testing, and they can test for co-infections. And you can, LymeDisease.org is a great website if you're ever looking for where do I send it. If you do a quick Google search, and LymeDisease.org also has a lot of great tools for people with Lyme and Lyme literate doctors and other things too. So I just want to put that out there too. So one of the most common things for knowing that you have Lyme is this rash. It's kind of that bullseye rash, but fewer than 10% of Lyme disease patients will develop this bullseye rash. So like I said, for myself, I didn't really know what a Lyme was, but when I go backwards in time, I don't ever recall having a bite or a mark or anything. So just something to be aware of. So Lyme symptoms, systemic. I have actually been connected to so many people with Lyme now, and I've never met two people that have like the same issues as far as symptoms go. You can have flu-like symptoms, chills, swollen lymph nodes, fatigue. I know I struggled with a lot of those things. I think there's like 2,000 things under the Lyme symptom list, and I probably feel like I could have checked the majority of those throughout the years that I went undiagnosed. A lot of digestive issues some people encounter. Some of you might be able to resonate with a lot of these on the list. We've got neurological issues. This really affected me neurally, so I did deal with a lot of neck issues, headaches, short-term memory loss. It was to the point where I was writing down my whole day because I would forget to pick up my child from preschool. So for me to be able to sit on here tonight and have a conversation with all of you and to spread awareness and talk and understand and like put my thoughts together, like, is a huge feat, like no other. Your heart can affect your heart. I had some palpitations. You can have shortness of breath, different chest pains. And then we've got the musculoskeletal, which I know a lot of people struggle with, the chronic pain, the migratory pain, the arthritis, muscles, aches, joint swelling, and all those things. So each person is different, and some people might have only a few of these symptoms, while a lot of people might have most of them. So Lyme disease, they call it the great mimicker because it is often misdiagnosed. I was put at the label with chronic fatigue syndrome, fibromyalgia. A lot of people, they thought I had MS because I was having a lot of numbing and tingling in my extremities, Parkinson's disease, ALS, brain tumors. I mean, all of these different things. It just it is often misdiagnosed or goes undiagnosed. So the testing is extremely unreliable. Often it is a clinical diagnosis because of everything I was going and I was responding to treatments and my kids all tested positive. It was pretty much a clinical diagnosis for myself. And they will, based on your medical history, symptoms, if you've been exposed and you know if you've had a tick bite, because the typical Lyme disease diagnostic tests are so insensitive, a negative test result does not mean that you don't have Lyme. Like I said, my one test came back indifferent. And primarily this might be a result because there might not be enough time for the antibodies to develop. Your immune system may be suppressed, or the person may be infected with a strain the test doesn't measure. So there's lots of reasons why you might get a negative result. 36% of Lyme patients were unable to receive a diagnosis before at least 6 years of illness. This has to change. Lots of different people that have Lyme also struggle from co-infections, making it that much harder to treat. I had 6 co-infections. I had Mycoplasma, Bartonella, Babesia, Ehrlichia, Rocky Mountain spotted fever, and I had Epstein-Barr virus. These are some of the most common co-infections of Lyme that it's like you're an onion and you're peeling away the layers and having to heal all these different things. So it really is something to battle, and it's really doing different things. So what do you do to treat it? What are strategies? I know that a lot of you on here have probably tried a million things and spent a ton of money because insurance hardly covers a lot of the things that are out of the box. It is not a one size fits all. I wish there was one protocol, one treatment. And I know that I'm not alone when I say that. So different things that people can try and different things that I know that I had tried, herbals, pharmaceuticals, antimicrobials, high quality probiotics, because we know that gut health is so important for the brain, anti-inflammatories, immune boosting therapies, biofilm busting therapies, diet changes. I'm still honoring a low inflammatory diet by not choosing to eat gluten and dairy. I'm really low with sugar just because I know what it can do for our immune systems. Reducing your toxic load, meaning your cleaners, your skincare products. I mean, you have to look at the whole picture if you want to heal the body. And it's really taking that burden off your body, that toxic load, where you're able to detox and heal and kind of tackle this disease. So cellular repair, this was huge. This was something that I knew 4.5 years ago, because I've been in remission now, probably close to 5 years now. And 4.5 years ago, when I learned about the cellular activation that we're going to talk about and healing the cells, I knew it pretty simple: healthy cells, healthy body, unhealthy cells, unhealthy body. And I knew that to get to the root cause of healing and what I needed to do, that I needed to heal the cell. So that's something that I've become very passionate about and sharing about as well. I did a lot of infrared saunas, pain management, IV therapies with different pushes and glutathione boosters, because glutathione is an antioxidant that a lot of Lyme protocols and doctors suggest that helps support your body for healing. So give the body what it needs. Recovery is possible, and I'm here to share that. And I'm privileged to be on here tonight, and I appreciate everyone hopping on. Belief, hope, faith, grace, compassion, patience, rest, recovery, being open-minded, possibilities. We have a miracle body and cellular health. Like, these really encompass systemically what you need in your body, need for yourself to heal. And this is my husband. We just went hiking a couple weeks ago. My oldest is like a nationally ranked runner. My 2 youngest are soccer stars, and they're thriving. And I do get emotional because it is a place that I hope that we stay in. And I know that being in remission it's honoring our bodies. It's doing what we know we need to proactively to keep this at bay and not have to revisit this in the past. And I'm grateful that Holly hopped on tonight, because she's going to kind of share a little bit just about I talked about the cellular health, the cellular activation, and what it can do for your body. And I wanted her to share a little bit about the science. So Hal, I'm going to have you hop on.
Yeah, thanks, Liz. I do, man. I get emotional still, girl. I've been hearing this from you for, 4 years now. And I just go back. I try to put myself in your shoes, like living the way that when we met, you were doing better. Not like you are today, but you were doing better. And to imagine you living with all of those co-infections and those symptoms that you had just like literally breaks my heart. And then knowing that you're girls, right? Like, how horrible that must have felt to know that, like, from that misdiagnosis, now your girls have this. And to say we're grateful for the healing that you've had, that your girls have had, and the way you guys are living your life right now is just, again, goosebumps. I'm a goosebump girl. So
Well, Holly, I appreciate that, but I will say, because I know a lot of people on here either know someone or struggling themselves, but like it is an invisible disease. So like I chose to put a smile on my face. I chose to get through the days. I chose to move forward and to actually feel like now I'm living my best life as far as, it's not like I don't have bad days. I do. It's not, I'm a human, but just to know that I'm never going to go back to what that was like, because a diagnosis almost was a blessing, because I know now what I need to do to honor my body and keep moving forward. So I appreciate that,
yeah.
Holly, and I appreciate you. So we're excited to hear from you.
Yeah, well, let's dive in just real quick, you guys, before we're done here. I think if you were to ask Liz, well, I'm chatting, I'm going to share my screen here a minute, so bear with me. I think if you were to ask Liz what it was that was kind of a game changer for her, she would say this thing called the Vitality Stack. So that's what I'm going to focus on briefly. But I want you to understand something. What we're going to talk about tonight with this whole cellular activation in the last couple of minutes we have, I want you to understand that this is not a theory. This is not something that's a whim. This is science. And that's what got my attention with these products and with this company. And I know for Liz, it was a game changer for her health and her family's health. But you guys were talking about activation, specifically NRF2 activation in Washington State. Washington State University said this, that NRF2 is likely to be the most important health promoting approach in the foreseeable future. And it may become the most extraordinary breakthrough in the history of health. That's remarkable. So we're going to talk about, getting to the root cause. Like Liz said, for so many years, she was having Band-Aids put on these symptoms, misdiagnosed, trying to figure out what was going on. But at the same time, masking symptoms was really the goal of the doctors. And I get that because we want to feel better. But like she said, if we're not getting healthy cells, our body is the most basic structure. If our cells are not healthy, our body is not healthy either. So we have to get to the root cause. And this is where this thing called activation comes in. So this is the product. This is our flagship product. If you and everyone in the world could do one thing for your health, one thing, it'd be this right here. It's the only product in the world proven to reduce oxidative stress. Oxidative stress is what damages our cells. It's the root cause of just about every known health issue known in humans, also in animals. So this is a game changer right here. And when I said we have studies, this is what I love, you guys. We're talking about over 30 peer-reviewed studies from places like Harvard, American Heart Association, the NIA, Washington State, and so many more prestigious institutions that when they found out what we had our hands on, they're like, wait just a minute, like for real? And they went to work doing their own studies, which is remarkable because, get this, you guys, it's all natural. Nobody studies natural products, like nobody, because pharma, there's no money in natural products for pharma, right? So the fact that this branded product, not the ingredients, not the theory, not the idea, the branded product has over 30 peer-reviewed published studies is absolutely mind-blowing. Why do we care? Because like I said, oxidative stress is the root cause just about everything that we know that affects our health. You can see what happens to the cell. The oxidative stress overwhelms the body. We have a system built in to counteract those free radicals, but it gets overwhelmed, especially in a condition like Lyme. It's drastically overwhelmed and the body cannot keep up. So we talked about detox. If you think back to this slide, the next to last one that Liz had shared, and it talked about treatments and strategies. This is the big thing. We're going to talk about the high quality probiotics, anti-inflammatories, immune boosting therapies, reducing toxic load, so important, cellular repair, but also the glutathione booster. So when you were talking about this NRF protein in our body, it supports your detox defenses. So when we talked about Liz is like, she knew her body had to detox. It probably wasn't doing it properly. This helps turn on those detox processes in your body. You talk about glutathione. When people have Lyme, they often want to try to supplement glutathione. Doctors and medical professionals want to help them with glutathione because we know that it's the master detoxifier. But we also know the body declines in production as we age or as we're dealing with an illness. You guys, your body makes glutathione. It makes it, you don't have to supplement. It's not very bioavailable when you supplement it anyways. Doing IV glutathione is very expensive. And again, it's so much more powerful for your body to make it instead of trying to take it. Guess what? This product increases your body's production of glutathione by 300%. Like if you don't think that was a game changer in Liz's body, like I promise you, that was a big deal. Again, it's made of 5 herbs: milk thistle, green tea, bacopa, ashwagandha, and turmeric. These ingredients alone, we know they're great, but on their own, you guys, if you're taking some of these, that's awesome, but they're not going to reduce your oxidative stress. They're not going to help your cellular health. Okay. They can do little things on their own. It's this patented, over 7 patents now on this product. It's the synergy of these ingredients, the way it's formulated in this product, that literally reduces your oxidative stress by that large amount. 18 times more effective than any of these on their own. So we're going to end it with this right here. We talked about the detoxification, the probiotic, and all of those important things in those therapeutic strategies. So this is the Vitality Stack. This is what she started with, actually. What's in it? It's our NRF2, which I just talked about, but it also has our NRF1. This is responsible for the mitochondria in your cell, right? The powerhouses of your cell. We know that when that is dysfunctional, it also leads to hundreds of different illnesses. So we need the mitochondria healthy and functioning properly. So again, we have healthy cells. But what about the gut? A high quality probiotic is one of those therapeutic strategies Liz mentioned in that list. Most probiotics, when you consume them, only like 4 to 6% even survive your stomach acid. 4 to 6% is better than 0, right? We know that it's better than nothing. But you guys, this probiotic is formulated in such a way that 60 to 70% or more survive the stomach acid, but it goes deeper than that. It's in a time-release formula. So the right guys that need to do the work in your digestive tract get to where they need to be. The small intestine, large intestine, the colon, they all get what they need through this time-release formula. So if you want a really good probiotic, I don't know of a better one than this. And the science and the way that it's formulated is amazing. I was paying more for a raw probiotic that had to be refrigerated before I ever learned about this. So this was kind of a no-brainer. Mine had no studies. This one actually has studies and is formulated in a way that no other ones are that I know about. And then the last thing is the omegas. Healthy cells need the omegas, you guys. They need it for the cell walls, for the integrity of the cells, to help it stay healthy and protect itself. Of course, the omegas do more too for our organs and our brain and our heart. We know they're super important, but that toxic load we talked about, if you're taking a low quality omega, you guys, it's often increasing your oxidative stress. It's often rancid fish. So if you want to make sure you're not increasing your toxic load, you need to make sure you have a high quality omega. This one is one of the best, again, that I know of. I'm sure there's other great ones out there. We don't have the only awesome omega. I just happen to know this one and how it's formulated. And I love this, you guys. It's tested. Every batch of raw materials in these products, I want you to hear me on this one. This is important. Every batch of raw materials is tested for toxins, heavy metals, pesticides, and every finished batch is also tested. That's unheard of in the industry. People skip lot test. Companies do what's called skip lot testing. They can test random batches. Our company is dedicated to making sure that we reduce toxic load. So these fish are wild caught, sustainably harvested from 2 places in the world and constantly tested. If you're going to do an omega, this is one that I highly recommend. So these 4 things in the Vitality Stack address these 4 important systems in your body. And I know we have another activator too called NAD. Liz was going to talk about Axio. I know we're out of time to reduce that brain fog. There's so much more information, you guys, as far as activation goes. We're just touching on it. So please, if you want to know more, make sure that you get this website that we have that's for education purposes only. It's just for you to go and learn. You can find your way around to some videos. livingactivated.info, and also ask whoever invited you for the ABC primetime video to give you some history to how this discovery came about and how the word started to get out. Okay, so I hope that was helpful. I'm going to check my notes just super quick and make sure, reducing that toxic load too. Like Liz was saying, make sure that what you're putting on your body, in your body, is as clean as possible. If you want to take this activation one step further, there's activated skin care, hair care, body care. We've got super, super clean products. If you want to go somewhere and just kind of keep everything that's going in and on you as clean as possible, it's kind of a one-stop shop here with this company, LifeVantage. So that's what I have for you. Liz, any other closing thoughts? I appreciate you guys taking time to hop on. I know we're a little bit over time, but there was so much information to go through. But we appreciate you. Get with the person who invited you if you have any questions. And Liz, we appreciate you. You sharing your story is so powerful. Thank you, thank you, thank you.
Yeah, and I just encourage you, just being how you're obviously creating awareness and advocating, and keep advocating for yourself. And if you ever want to connect personally and you're dealing with stuff and you just want to talk to someone, I probably can resonate in some way. So, either reach out to the person that invited you and they can connect us. So thank you guys for hopping on tonight. I know Holly put in the comments too, if you want to learn more specifics about cellular activation in our products, there is another Zoom that's going on, just started at 8:30, that a couple of doctors in our company are going to be going more into the nitty gritties of how activation differs from supplementation. So appreciate everyone for hopping on and taking some time tonight. Take care.
Thank you guys. Bye-bye. Have a good night.